Hello, everyone. Welcome to the Health Tech Edge, where we talk with industry experts about the latest topics in healthcare technology. I'm your host, Mike Moore. Our weekly panelist, Raheel Reddywala, Chief Strategy Officer of Productive Edge, joins us today. And our featured guest is Adeline Ashley, Director of Customer Engagement at Sitecore. Thank you for joining us.
Thank you for having me.
Hi, Adeline.
Hi.
So we bring on guests from the industry, customers, partners, experts, and we're fortunate to have you with us today, Adeline. I went to the team that we work with as a Sitecore partner and said, who do you have that has a healthcare background and really can help us understand Sitecore's point of view? And you were the first name that they came up with. And you really have a great background in healthcare as a customer before going over to the vendor side and the work that you do with Sitecore. So we'll get to that in a moment. But why don't you just share with our audience first off your background and kind of what led you to this point in your career and how you've worked through the healthcare system?
Sure. I've been involved with digital transformation on websites and experiences, most recently with Anthem and with ProMedica. And when I was at ProMedica, I was charged to really innovate and get together the senior care system, the insurance, and the hospital healthcare system all under one roof for a digital experience. And so that led me to looking underneath the hood and looking at, what is the MarTech stack, and then eventually evaluating the content management system, which led me to look at Sitecore and Adobe and others. And I chose Sitecore, and we started down that path, but then Sitecore stole me. And now I'm on this side, which I'm able to share my experiences with customers. I never talk about products, but I really help them with getting their needs to reach the right digital experience for their customers or their patients in this case.
Yeah, certainly makes it easier when you've walked more than a mile in your customer's shoes and can relate to the challenges that they face, and especially in today's healthcare environment. So let's pivot into that part of the discussion. So, for a long time, everyone who carries a smartphone has those kind of expectations that every company, every business, every organization they interact with is going to deliver these elegant digital experiences for them. But as all of us know here, healthcare has been behind the rest of the world. And a lot of it, I think, Raheel, you talk about this quite a bit, the complexity of healthcare, right? Just the systems, the processes, the tools, the bureaucracy, there's a lot to it. So let's think about maybe the changing role of healthcare and why is this transformation starting to affect healthcare organizations and their ability to be more responsive to the needs of consumers? What's your perspective on that, Adeline?
Well, my perspective is that folks, like the role, I think, Raheel, we talked about this, the role of the CMO is changing, right? And the business is changing where before, people were looking inwards and they were looking to the doctors to help guide what is that relationship. But as you had mentioned, Mike, the patient and customer centricity is really important. So recognizing that, you'd have to start building different teams, start looking at how do we reach that and then help guide that conversation. So I think that's the pivotal moment. What do you think, Raheel?
Yeah, I agree with you, Adeline. I think when you look at the evolution of customer centricity and the pivot that many industries have made over the many last years and the application of digital technologies to drive that sort of, pivot, it's been challenging in healthcare because if you look at, the investments that healthcare organizations had to make, the digitization in healthcare, that was a big phase, right? The focus on value-based care and the business model, that was a big phase. And then when you kind of step back out and say, okay, where are we heading with all of this? There's a clear demand from the consumer, the patients, the members around their participation in their own health, their transparency and clarity as to what healthcare they're receiving, what does it cost, and more importantly, how do I keep myself healthy and continue to do so? And that's when, as you said, healthcare organizations have really started to think about, well, what is now kind of looking at the consumer and making sure that the investments we make and the things we think about are catering to the needs of the consumer. And as you said, who carries that baton within the healthcare organization to think about this and then do all the things necessary. And I think your experience working on in the marketing team, curious as to what you've seen as to who's carrying the baton, how they're going about doing it.
Well, from what I see, working with the many healthcare companies that Sitecore has the privilege of working with, it's the CMO, right? They're the ones that are making those decisions and gathering the band of folks underneath them, from the IT to the marketing departments to digital departments, to all working together in concert so that they meet the demands, right? It's no longer a situation where I can just do my own work and pass it over to somebody else and they pick up from there. We all have to work together. There's that need to break down the silos. That's absolutely pivotal, right? And then all working towards that North Star vision.
Exactly. That's similarly, we see that all the time. And I think rightly so, right? I mean, from a CMO's perspective there, that's sort of the first mile experience, right? With the consumer, if you may. So it's a very natural to say, okay, how do we think about acquisition? How do we think about the entire journey now? And how do we think about participation of the various business functions and their sort of technologies that may be already in place? How do they manifest themselves in throughout that journey? And how do we then think about personalization? How do we think about engagement and proactive engagement? And how do we think about loyalty and brand and brand loyalty as well? So the CMO certainly is the role that's sort of taken that. And what we've seen is that the CMO then has other team members that they've built to support that that need. So whether you have a digital function underneath that, maybe you have an experience function underneath that, and in some cases you also have a data science function that's starting to support sort of the more of the emerging advanced use cases as well.
Yeah, I see that. And I guess this would be a good time to share how we try to get those things orchestrated here at Sitecore, right? I mean, one of the things that my team does is that we don't talk about product. We've got the salespeople and the solution engineers and you guys partners to talk about that. But we try to, at my team, we try to work with the companies alongside with them and be their trusted advisors. And we offer services like a road mapping workshop in which we do gather all the different stakeholders, those who touch the digital experience in some shape or manner. And we get them in a room and we do fun exercises, kind of like a therapy session, like what's working for them, what's not working for them, and then what is their dream state. And, there's a lot of revelation that happens in there. There's a lot of magic and great nuggets of information. And then at the end of the day, what my team does is we distill all those things. And it's not just about presenting, oh, here's the tech stack that you need to do this. It's really about thinking about the strategy, what is the objective that they had, and then coming up with the people, the process, and then the technology and other important aspects that all work in concert so that they can accomplish what they're looking for. And that's the stuff that we like to do here at Sitecore.
Adeline, I'm curious, how do your customers then go from sort of that view, the execution, right? Have you found, challenges in getting started? And if so, what have you seen work as to from those roadmap sessions and sort of that high level visibility now? Oh, okay, I see how I could potentially go about to then starting.
Well, I think it's really important to have partners. I mean, you guys are definitely a partner and working closely with the partners. So, and many times we include the partners in these road mapping sessions because it's very valuable for them to see that as well. And we all work together in concert. And then the partner, if they're in that session, has a role to, communicate and put their stamp on it as well, so that we're all working from the same book. And then what happens is we start the process of like, what does it take to get the low hanging fruit going, right? And then because it's a roadmap of maybe 2 years out, we have a constant checkpoint with them, whether it's every 2 months, every 4 months or 6 months, whatever the cadence is. We look back and things happen, right? COVID happened. If there has to ship, we'll have to do something there, but it's important to check back and see how you guys are doing.
So Raheel, with the work that you've done with healthcare organizations in this, where do they start as kind of a first phase? Like there is like going through imagining the state of the future and how wonderful things can be is great. But then I think like you're indicating, you have to kind of chunk it out and figure out what are some milestones, what are some deliverables we can achieve that start to show value, because ultimately the healthcare system is a commercial entity, right? They've got finances, they need to make numbers happen, all those kind of things. So where are the organizations that you've worked with starting out in this process?
Yeah, that's a great question, Mike. I mean, I think it generally depends on maturity, right? First of all, where an organization is in their maturity. So for example, like if you look at the stack, you'll find that there are some core components to it, right? So first of all, there's a CRM component to it. There is a data and data strategy component to it. So what is your customer 360 strategy? What is your provider 360 strategy? Because if you don't really have that and aren't at least thinking about it, then how you surface the right insights in the context at the right time in the digital investments you're making is going to be difficult. So there's a data strategy component to that. And then there's, certainly an experience, a strategy. And then tying it all together is an omnichannel strategy, which says, okay, how much of it are we going to enable from a self-service perspective? How much are we going to deflect? How much are we going to augment our own people with digital capabilities so they are more efficient at delivering, the service that they deliver? And how much of it is about optimizing our processes, automation, and automating those? So it's when you kind of combine those 4 or 5 pieces together, you start to build that roadmap. And that in some ways, we have had clients, for example, that have had a decent investment in CRM, but very low maturity in a data strategy. They may have had a tool that does a decent job on MarTech automation, but isn't really a good environment, a good tool for really broad thinking about omni-channel personalization. So what is the next phase of that? So it depends on what obviously also are the strategic goals, right? So if the strategic goal is I need to really focus on acquisition and grow and make it easy for people to get access to the caregivers, if that's your strategic goal, then how do we map that back to the roadmap and the tech stack and the processes will differ versus if you were in some cases advanced and you said, well, I really want to focus on chronic condition management and really make sure that I'm proactively engaging the population that's, that shows a high level of risk in chronic conditions, right? How you deal with that as a strategic initiative might be different in that case.
Mm-hmm. Yep. And there's so much to choose from, right? So we have to very much make sure when we're in those road mapping sessions, we kind of pick 1 or 2, right? So that we don't boil the ocean. We pick 1 or 2, and then we can go back and optimize. A
simple one is, for example, how many, like if you're a payer or insurer, how many can understand why you came to the website? Are you someone who is interested in Medicare? And if so, am I able to, on your next visit, give you the right pieces of content and the information? Am I able to understand how are you engaging with that pieces of information and that content? And am I able to then convert you to a customer, right? Again, just that sort of very simple use case. How many of our customers are able to do that well, right? So if you boil down all the things around personalization and all those are grand things, but when you talk very simple use cases like that, how many are able to do that effectively?
Yep.
Well, and I think that's ultimately delivering those patient and member experiences, whether we're talking about providers or payers, that going back to kind of those consumer examples, right? That are very elegant, that we've all been through the call router where you put in your information and then you get somebody live on the phone and they ask you for, your name and date of birth or your phone number, or, all those things all over again. And we know that healthcare is capable of more because other industries and other experiences are doing it. And I think you have a story, Adeline, that you like to tell about how it unfortunately hit home for you and your family and kind of the expectations versus the reality of the healthcare system and a bit of surprise. So you mind sharing that with the audience here?
Sure. I'm happy to share. My husband's an avid skier, and he went out to the West Coast to go ski, and he was by himself. And I was here in Toledo, and I found out that he had a serious accident in which he shattered his C6 and C5. And I had been talking to the emergency room, and they said, yeah, we're packing him up, and we're taking him to a renowned hospital because he needs to have surgery. And I was in so much shock. Like, what? And anyway, long story short, I get there. We had to wait 3 days before he could have surgery. And once he was able to have his surgery, the nurses had said, gosh, you're so tired. You've been by his side. We will take care of you and making sure that you're informed all the way through. And I didn't believe it. I mean, I was like, there's no way. They're so busy. There's just no way. I need to be by his side. And they said, you can't. Go and have some food, and we promise we will keep you informed. And they lived up to their promise. It was almost like a Delta experience in which I'm getting notifications that my luggage has boarded the plane. I got the same notification, similarly, that my husband, it said the patient is in pre-op, he's fine. Then it said, a couple hours later, the patient is in the operating room, he's fine. And then the next one was, the patient is out of the operating room, the doctor will call you. And I'm like, I could not believe that. I did not expect that experience, right? But because I love Delta and I love that experience, that was something where I now, when I go talk, I talk about, like, this is something that if healthcare can come to a situation where they can bring those experiences that customers and patients experience every day into the healthcare system, that's going to delight them and make them be a loyal customer there. And that's you can't ask for more than that.
I agree. Couldn't agree more. And if you think about what it must have taken for that health system to go about and invest in that above any other use cases and scenarios, like, it goes to show that how the customer centricity must have hit home there, how they must have prioritized that particular use case, how they must have, thought about the families and the caregivers, how they would have thought about the omnichannel engagement and the notifications. It really required sort of that broader thinking, and it required not just the marketing team, but it required clinical teams, the EHR team, all of those teams to come together and in the end build a solution that delights consumers and patients and families and caregivers. So really great use case and scenario. And I just think that healthcare is at a cusp of turning on a lot of these kinds of use cases through very intelligent engagement methods and modes, and it can just be a great experience for everybody.
I couldn't agree more. And I almost think, how we joke about that healthcare is kind of the last of everyone to do things. If healthcare continues to do things like this, I think they'll start becoming the forefront, right? And leaders in that. So it's awesome.
Well, and thankfully it had, it's more than just a good story to tell. It had a good outcome for your family and for your husband specifically. So, it's always nice to know that your luggage got where it needed to go. It's even better to know your family member made it through, one of the most challenging times in your lives, right? So, and I think you told me before too that this wasn't kind of known to you at the time, but that hospital actually happens to be a Sitecore customer. Is that right?
It does. I mean, when that all happened, I was like, wow, this is really cool. I have to go back and tell the folks at Sitecore, like, this communication is cool. And then I looked up on Salesforce, I'm like, oh, they're also a Sitecore customer. So it was awesome.
Yeah. And I think that the emphasis on what Raheel just talked about, to me, is a really important note for people to capture. It's not just about the tools, right? It's about putting together the framework and the use cases and how all of these tools can be used, and deciding what's most important to our patients, their families, our health plan members, whoever the audience is, whoever the consumer is, right? That has the dollars in hand, that can shop with their feet, right? They can leave and go to another organization. So by prioritizing some of these use cases about what people care about the most, and then selecting tools that enable that, and then connecting data that enables that, right? These are pieces that come in afterwards, but the planning up front, this digital transformation and the strategy around that, and the prioritization of use cases is really the key that drives the action that follows.
Mm-hmm. Couldn't agree more. Yep.
And so that I think is, hopefully the key takeaway for many. So where do we go from here? What's next as far as Sitecore and healthcare, Adeline? Any sneak previews of things that are coming or related to healthcare that the audience would want to know?
I'm actually excited to share that we are this close to getting HIPAA compliance with CDP and Personalized. That is coming up in July timeframe. And then closely at the heels of that, we will have XM Cloud and Content Hub at the end of the year. So having that HIPAA compliance really strengthens the capabilities and the possibilities for healthcare to utilize our tools and achieve the digital experiences that they want to achieve with Sitecore.
That is great news.
Yeah, I know.
I know for a fact many clients are waiting for that. And if you're listening and aren't aware of what Sitecore, CDP, and Personalized are, I highly recommend going in and doing a quick search and taking a look at it. Very powerful technologies, really deliver sort of that context and personalization capabilities that are data driven. So yeah, very exciting news. Very exciting news.
Yeah.
It's once we're limited only by our imagination because all the tools are capable to deliver the experiences we want to deliver for patients and their families. That's the sky's the limit at that point. And then I think we can achieve the holy grail, Adeline, that you mentioned of healthcare starting to lead and demonstrate to other industries what is possible. So, all right. Well, that's all the time we have for today's episode of Health Tech Edge. We hope you'll come back and join us next time. But Adeline, thank you so much for being our guest today and sharing your insights with all of us.
Thanks, Adeline.
It's a pleasure.
Same.